Excellent.
Yes.
Okay, that's beautiful. So basically, everybody has got access to a logbook. If you're not, if I haven't kind of given access to you via Dropbox, I've emailed it to you. And the intention from our perspective is that you can use the logbook to have people peer review either in your own institute. You can have peer review with colleagues if the multiple people doing this as part of the course. But the intention from our perspective is that we will go through a lot of the topics here. And as you go through and record your views when you have a look at cases, my expectation is that you, from your perspective, start signing out undersupervised. So just again, just to make things completely clear, can you see my cursor moving?
Yes.
Yeah.
Yes.
So the idea
Yes.
from our perspective is that rather than fill in the observe column, which is generally for people who are observing the first 5 scans when they use a log, say in my institute, I would say that you'd start filling in these columns. And a lot of you will start doing anterior and lateral views. So you can actually, when you do your first scan, just write the date for it. And really, what I would then do is for those of you whose scans I peer review online or I peer review because you stored it in the Dropbox, I will then basically put signatures in to kind of record that you've actually achieved that particular aspect. Now, simply if I see that you've done anterior lung views and you've got a bat sign, they're A lines, they're B lines. In essence, I would sign those off with a date to kind of say that you've achieved those competencies. Now, naturally, my expectation at this particular stage is that you go through and record these things, but really what I want you to kind of look at is doing 5 scans. And those 5 scans are really about pattern identification, pattern recognition. So this is the column, the standard views that you'd really be looking at in these 5 scans over the next 4 weeks. So we want you to achieve these, and I'll be talking to you about them today. But really, after the first 4 weeks are over, we would have covered the normal and the abnormal lung. So the intention from our perspective is you then move to a kind of recording pathology. And your pathology would come in week 2 to week 6, depending on how advanced you are with scanning. I mean, some of you would already have been scanning, and it may be that you meet the standard views very quickly and you start saving images of pathology. So again, what I would do is you'd mark them in your supervised column with a date and a time, and then I'd have a look at your Dropbox or the peer review and sign them off with a date and time over here. Now, you would populate your competencies as you feel you've achieved them. Naturally, I think if we find that there's a little bit of a mismatch between what I'm seeing and what you're saying, what would be nice is for us to kind of maybe have a little bit of a powwow to kind of figure out which areas I might have missed. But when you present cases, this is a Word document, and really what it allows you to do is log the cases that you're kind of storing by date without identifying them, but maybe having a gestation and a wait for yourself to kind of show the variety of scans that you're actually doing with the indication of why you're doing the scan, what significant finding there was, and really if there's a critique when you do peer review and we find that we might be able to optimize your images, or if your images are absolutely excellent, which they might be, then in that particular situation, we might just have a point of reflection to kind of highlight how good your scanning is. But you can actually store the files. And how do you store files? And I'm just going to go through it with you. So when you go to the insert column, and this is just the insert column over here, you would have a file stored as a PowerPoint, which would have the case history and the images embedded, as I will show you today. A small file, what I'd say is 4 slides, presents the history, presents your anterior, your lateral views, and the fourth slide, if you can, anonymizes your chest x-ray. So you can actually use that as your gold standard for the diagnosis. But you can insert that by using the object column over here, which says insert an object. And that basically allows you to store your file in whatever way you want by creating and browsing on your desktop to actually insert the stored images over here. Now, the benefit of doing that is that actually towards the end, when you've got a substantial amount of images, I would normally, from my perspective, sit down on a Sunday and go through all the logbooks. It's usually 3 or 4 hours worth of work for me. But the intention from my perspective is then to kind of sign off what you might have achieved in this particular box if you don't have somebody who can peer review. But this then becomes your record for life of your scans. Now, I'm just giving you an example, and I'm going to kind of just show you what a logbook might look like. Just opening my logbook just to give you an idea. This is the blank version. My apologies. Can everybody see this logbook?
Yeah.
Okay.
Yes.
Yes.
So basically, from my perspective, you can see how uh, I have logged images, and really I have hyperlink files. If I click on this particular file, I can actually open the PowerPoint presentation which stores the images, which go back to my logbook. And I've just kept a log of all the images that I've kept over time as proof. Now, I'm not saying you have to do this. You don't really have to do this. But for those of you who would need to prove privileges, say in a country like the UAE or the States, having a logbook really helps. It just means that when you move institutions, you can actually use your logbook to actually show them the breadth of the images that you take. And you can do this for basically any form of point of care ultrasound. Uh, any questions about the logbook?
Yeah, so like as you have told that we need to save 4 slides. So we need to save only the images which are like pathological images or
Of
like
relevance,
all
yes. Because
okay.
what I'd say is that if you start storing all the files and a comprehensive scan, and I'll talk about it today, will have images that basically include anterolateral posterior, which is R1 to R6, L1 to L6, 12, and then each intercostal space, anterior and posterior. That's a massive file. It's also a huge amount of handling for the baby. So my expectation is that you store the clips of interest, which is what I'm going to show you today, really, because those are the ones that might be relevant for us making a diagnosis. And in essence, I think we should limit all your presentations to 4 slides: a case presentation with the history, first slide, second slide, and third slide should be right and left regions. And then you mental model with a diagnosis by looking at those images, followed by a fourth slide, which, where possible, if you have the chest x-ray, that's well and good. We don't need the chest x-ray. We can make a diagnosis based on clinical correlation anyway. Does that clarify?
Yes, and what about peer review presentation? Like in that also we need to make only 4 slides, or
Only
we
four
need to cover
slides.
all the
No, no,
details.
only 4 slides. If you have a very interesting case and you want to share further images, then please let me know in the WhatsApp that you're going to have a slightly extended presentation. Now, peer review will, as I said, for the sessions that I hold, will be 30 minutes prior to the session. But there will be, and I know that there are lots of you who want peer review in this particular group. For those of you who say want to do long peer reviews, you want to use the OSAL forms, there will be Thursdays, like next Thursday, where I'm organizing just pure peer review. For those of you who've done scans, some people from the old batch, you don't have to attend them if you don't want. There's enough in the course for you to attend the normal sessions and get everything that you need. But for those of you who want to, there's peer review in that, and I'm very happy to kind of just focus on peer review, which means you don't have to worry about the theory.
Dr. Alak, what about if there's a case of extreme prematurity with severe RDS? So if we need to present, then we have to cover all the areas
No, we
for
don't.
grading.
No, we don't. Anterolateral scanning in a case with severe RDS would be sufficient to make a diagnosis. If the baby is actually supine, what I'd say is you do the anterior and lateral regions. Why would you want to do the posterior regions, which will only be wet with more fluid and probably give you the same findings as the anterior and lateral regions, unless you're worried about a mnemonic consolidation?
In on either side, like right and left. So
Mhm.
like it
So
will be four
there are
regions if we do
two
just
schools of
anterior.
thought. Yeah, there are two schools of thought. There is a school of thought which says we should do comprehensive scanning. But actually, if you read the most recent meta-analysis that's been published by Guo et al. From the Chinese theater, they're quite happy that anterolateral scans give you just as much information, allow you to make the diagnosis. And really, if you look at scoring methodology, Brat's score is very sensitive. It involves only anterolateral regions. You do not have to score the posterior regions. There is no current evidence that scoring posterior regions and adding to the anterior regions and lateral regions is any better, more sensitive, or more specific in helping you differentiate or diagnose respiratory distress syndrome.
Dr. Alok,
Yeah,
about the storage image of preview.
yeah.
So I can go through the six imaging, just I will give بس مثلا, for example, I have pneumonia in the right lower lobe.
Yep.
I consider I will present only the pneumonia while I present the other segment.
So what I'd say is let's make a start. Let's see how you get on. Maybe that's a case that I would keep for the longer peer reviews. It would be nice to see all the segments, and that's where I would do a comprehensive scan. So for a baby that's supine, mnemonic consolidation tends to localize to the PLAPS region, can be posterior because of how exudate goes. That's where you'd need a comprehensive scan. And I think in that situation, if you wanted to show us a comprehensive scan, I have no objections. Obviously, what I'd say is that on your slides, as I'm going to show you today, I would say no more than 4 images or 4 loops, and the loops should be pre-activated just in the interest of time. Otherwise, what happens is, in order for us to see the loops, you have to click on it each time. I'm going to show you when I do the presentation today how you can embed loops which are running automatically, which kind of means that they loop and they keep looping, and it just means that we save a lot of time during peer review.
Okay.
Dr. Alok,
Yeah.
are you expecting us to take videos or pictures?
So
Hmm.
my advice would be loops. Pictures won't tell me anything about sliding.
Yeah.
Pictures would not necessarily tell me anything about dynamic air bronchograms. They, in essence, if you have a consolidation in the PLAPS region that is changing with inspiration, expiration, or if you want to see lung aeration, which is better in inspiration, you won't be able to get those things. So I would say that we need to have loops. So it's videos. For those of you who can download, use the anonymous settings on your ultrasound scanner. I will be taking some videos over the next few days showing you how I do it from my machine. For those of you who are not able to download, you can record your screens, completely omitting all patient identifiable material and store them as small loops, preferably, I would say, 6 to 10 seconds max, which you set in loop on the PowerPoint. And that basically means we can review them. If you can't do that, I'm quite happy with photographs. I have no problems. Do what you can, do what's convenient to you. Don't kill yourselves. That's important. Any other questions? This is a very important session, so I am going to dedicate some time to questions at the start.
Dr. Alok, can you please show how to insert the PowerPoint to the Word file?
I will show you that when I do my presentation today, because I'm going to present a
Okay.
few cases right at the end of it, and I'll show you
Yeah.
how to do that. It's very easy.
Okay.
Any other questions? Okay, one very important thing. I have 32 of you here today. Uh, I need for everybody to reply back in the WhatsApp to confirm that you can access the module and that you have access to the Dropbox, both the library and your Dropbox folder if you need it. If you don't, no longer write in the group, please PM me, private message me, and I will sort it out if you're still having any problems. I don't see that anybody has any problems. I can see in my Dropbox that everybody has access, but if you're still having problems, we need to sort this out before we move forwards.
The Dropbox is asking for some payment to get
No, no,
access.
no. It's because you're registering. You do not need to register. So what you need to do is you need to go to your email, click on the link, and it will ask me to provide permissions for you to access my Dropbox and use that as a file. So if you're trying to synchronize with your Dropbox, your file storage is limited to 2 GB because you're using a free file. And the challenge with that aspect is that if you then want to store much more, Dropbox will ask for a payment to enlarge that. We're sharing files and you're using my Dropbox. So if you click on the link, you should have access. If you have registered with your email and already have a Dropbox account and you're trying to synchronize, then that problem will occur. My advice is don't synchronize. Store your logbook on your computer in a set place and basically store images as I've described today. Make a record of it. And every Saturday, what I would say is your Dropbox folder can be accessed. All you have to do is cut and paste your file into that Dropbox folder. And that means I can access it and you can access it as well.
Okay.
You should not need to pay for it. Absolutely not.
Okay. Okay. That's fine. Thank you.
Any other questions?